Cities are at the middle of this pandemic, as they need been during numerous plagues in history. The virus originated during a crowded city in central China. It spread between cities and has taken the foremost lives in cities. New York has become the world's saddest, most dismal viral hotspot. Hunkered down reception, rarely venturing into hauntingly empty streets, most folks are still at a loss at how urban life will look afterwards. Will restaurants survive and jobs come back? Will people still travel in crowded subways? Can we even need office towers when most are on Zoom? Come to consider it, the thought of living on a farm seems suddenly attractive. Cities thrive on the opportunities for work and play, and on the endless sort of available goods and services. If fear of disease becomes the new normal, cities might be certain a bland and antiseptic future, maybe even a dystopian one. But if the world's cities find ways to regulate, as they always have within the past, their greatest era may yet lie before them. To help us add up of urban life after the pandemic, Policy asked 8 leading thinkers from around the world to weigh in with their predictions. Cities Will Shine at Disease Prevention and Response by Rebecca Katz, a professor at Georgetown University Center, where she directs the Middle for Global Health Science and Security. The world over, children have flocked to urban environments in search of labor and education, opportunities to interact with others their age, and new experiences in culture and therefore the arts. With the continued transmission of the coronavirus and given our new awareness of the risks of infectious disease, population density has suddenly subsided. Attractive shared apartments, which are a reasonable launching point for newcomers to experience the breadth of cities, became claustrophobic under quarantine. At an equivalent time, we've seen the urban rich, who have gentrified city after city, escape to their summer homes. Many of them may recalculate their preferences permanently. While it's impossible to predict what the new normal are going to be, it's going to rather be reverse urbanization. Now that numerous folks have created new routines working remotely via countless Zoom teleconferences, we may start to ascertain an exodus from the town to more rural environments. While it's impossible to predict what the new normal are going to be, it's going to rather be reverse urbanization. Yet we also fully expect that municipal leaders will shine at disease preparedness and response. What was once an underfunded, understaffed area of health departments will become more robust. We'll develop best practices for shielding population health in cities, which can help keep urban environments attractive. We can create a far better urban future where nobody is left behind by Maimuna Maud Sharif, the Chief Director of the United Nations Human Settlements Program. Around 95% of individuals with COVID-19 sleep in urban areas. This has brought into sharp relief a number of the elemental inequalities at the guts of our towns and cities. COVID-19 will hit the foremost vulnerable the toughest, including the 1 billion residents of the world's densely populated informal settlements and slums, also as people lacking access to adequate, affordable, and secure housing. Without a house, it's impossible to heed the decision to remain reception. Without safe shelter and access to basic services, the order to shelter in situ has no meaning. Without safe shelter and access to basic services, the order to shelter in situ has no meaning. This pandemic is already exacerbating the urban divide that has resulted from a long-term failure to deal with fundamental inequalities and guarantee basic human rights. The post-COVID-19 response would require these failures to be addressed and urban residents given basic services, especially healthcare and housing, to ensure everyone can accept dignity and be prepared for subsequent global crisis. Local authorities will need to be the drive in reducing inequality, supported by national government policies that increase the resilience of cities and their residents. The eternal optimist in me aspires to, and firmly believes in, a far better urban future during which nobody and no place is left behind. India's cities will hamper, becoming cleaner and fewer crowded by Kiran Bedi, the elected official of Puducherry, India. She was the primary woman within the Indian police service and served as a military officer of the Delhi prisons. Cities will get less crowded and hamper their pace. Rapid migration from rural to urban areas, like what we've seen in India, cannot continue at an equivalent speed. People may start reconsidering agriculture. Rapid migration from rural to urban areas, like what we've seen in India, cannot continue at an equivalent speed. Cities will lose a part of their variety and public social life. There'll be less eating out, more home delivery, and lower consumption of luxuries. Public cinemas will become home cinemas. Gyms and hair salons won't be in demand for quite a while, unless good practices of social distancing and hygiene are maintained. Commercial sex are going to be out of business. Urban transportation will need to be more personal for reasons of social distancing. Travel will diminish everywhere, and international city-to-city travel will become much more expensive. The way we add cities will change. Performing from home are going to be an option, supported by teleconferencing and cloud-based sharing, including in government administration. Office space will come at a way lower rate. The urban air are going to be much cleaner, and concrete life less costly. Create the safe and resilient city we've needed right along by Jeanette Sadek Khan, a principal at Bloomberg Associates. From 2007 to 2013, she was the commissioner of the New York City Department of Transportation. The road to recovery from this pandemic runs along our streets. We will bring back cities without bringing back the traffic, the congestion, the pollution, and the 1.3 million people that die in traffic crashes per annum. We will reclaim and reset our streets to maneuver people by foot, bike, or public transportation and roll in the hay safely, affordably, and simply, regardless of where they sleep in the town. And that we have a chance to offer city residents round the world true transportation independence, real choices for getting around, and therefore the freedom to not need to own a car. The pandemic reveals just what proportion cities depend upon essential workers and what proportion essential workers depend upon conveyance. The pandemic reveals just what proportion cities depend upon essential workers and what proportion essential workers depend upon public trains and buses to succeed in jobs at hospitals, grocery stores, and other links within the supply chain. Our ability to endure this pandemic relies on new safety protocols to stay passengers and conveyance workers safe, and on investing in extensive service expansions to form subsequent crises easier to manage. This challenge we're faced with isn't whether cities will survive as we all know them. The question is whether or not we'll have the imagination and vision to rework streets and convey about the safer, more accessible, and more resilient cities we've needed right along. New Institutions Will Bring Back Cities by Bruce Katz, founding director of the Nowak Metro Finance Lab at Drexel University. History teaches us that crises usually cause new government agencies and institutions. The US created the Department of Homeland Security after the 9/11 attacks and therefore the Consumer Financial Protection Bureau following the 2008 to 2009 housing crash. The coronavirus pandemic is therefore likely to drive institutional change in cities, where new capacities will need to emerge to deal with economic devastation. History teaches us that crises usually cause new government agencies and institutions. The unprecedented collapse of small businesses, particularly those along commercial corridors in disadvantaged communities and people owned by people of color, would require new public or nonprofit intermediaries to supply services to financially impaired firms and complicated training to new entrepreneurs. We have already got business incubators and accelerators. What we'd like now are regenerators. These should ensure access to equity-driven financial products, instead of simply providing more debt. At an equivalent time, public land banks and nonprofit development corporations which allow land to be pooled and revitalization to be accelerated will grow in significance. Models like Copenhagen City and Port Development Corporation or Cincinnati's Center City Development Corporation, long admired but rarely replicated, are going to be fundamental to urban recovery. Without radical institutional change, the inclusive recovery of cities are going to be a really while in coming. Urban Housing Will Get Cheaper by Joel Kotkin, a fellow at Chapman University, the chief director of the Urban Reform Institute, and therefore the author of The Approaching of Neo-Feudalism, a warning to the worldwide bourgeoisie. Cities will remain critical to human society, but they have to vary. The coronavirus and high-density living have gone together from the start, from the pandemic's genesis in crowded, unsanitary urban China to the much higher rates of hospitalization and death in large cities round the world. The contrast to the less dense hinterland couldn't be starker, especially within the US, where New York City has borne the brunt of the pandemic. Answers may include developing personal, autonomous transport systems rather than forcing people into crowded subways. Answers may include allowing more growth within the periphery, which might require substantial changes in land use and zoning regulations, encouraging remote work where possible, and developing personal, eventually autonomous transport systems rather than forcing people into crowded subways. When cities were afflicted with pandemics within the early 20th century, society responded with dedensification. Manhattan went from a population of nearly 2.5 million in 1920 to 1.5 million in 1970. An identical process occurred in central London and Paris. As more people moved to the periphery, cities got safer and more sanitary. An identical strategy will help us within the future. Some dispersion of the population may additionally allow jobs to open up and reduce urban housing costs. Subsequent generation of suburbs, however, will need to be designed for lower emissions, more home-based work, and shorter commutes. A warning call for cities to rethink their economic model by Chan Hung-chi, a professor at Singapore University of Technology and Style and therefore the chair of the Lee Kuan Yew Center for Innovative Cities. The coronavirus pandemic has been a warning call for cities around the world to rethink urban planning with health security as a top priority. In Singapore, the health system was already reorganized within the wake of the 2003 SARS epidemic, but this coronavirus is different. There are many aspects to health security that pose special challenges for a city lacking a rural hinterland, especially those involving the vulnerability of medical and food supply chains. Many aspects to health security pose special challenges for cities, especially those involving the vulnerability of medical and food supply chains. Another aspect during a city like Singapore is securing the health of the massive population of migrant foreign workers who have helped build and sustain the town. Singapore's total population is 5.7 million, of which just about 1 million are semi-skilled and unskilled workers, including foreign domestic workers and roughly 300,000 migrant workers, mostly working in construction. Most are housed in mega-sized dormitories. This close communal living, also as crowded work sites, facilitated the infection of the many workers during this pandemic. Post-coronavirus, the planning of the dormitories will definitely be revisited and protocols strengthened. And it's almost certain that the present economic model, one that relies heavily on migrant workers for growth and development, will be rethought. The promotion of technology to extend productivity, long advocated by the government, are going to be stepped up with a greater urgency to scale back the reliance on manpower for productivity. We must restore confidence within the safety of dense living by Dan Doctoroff, the CEO of Sidewalk Labs and a former deputy mayor for economic development and rebuilding of latest York City. Cities will come stronger than ever after the pandemic. But once they do, it'll be driven by a replacement model of growth that emphasizes inclusivity, sustainability, and economic opportunity. Even before the crisis, urban communities around the world were demanding lower costs of living and stronger plans to tackle global climate change. Some unaffordable cities, like New York, were even seeing residents leave town. Cities will come stronger than ever after the pandemic. Reviving urban increase after the pandemic will start with restoring confidence in urban public health and within the safety of dense living. But when people do return to cities as they always have within the past, we must leverage new policies and technologies to form urban life cheaper and sustainable for more people. Cheaper, more flexible building methods like tall timber construction can lower the value of housing and dramatically reduce the carbon footprint of latest buildings. New mobility options and transportation system extensions can help residents reach jobs without having to have a car. Energy innovations can enable all-electric neighborhoods that reduce their climate impact without utility bills that break the bank. If we take this chance to create better, cities won't just recover but provide greater opportunities than they did before the coronavirus struck.